My name is Nunik Kusumawardani, and you may call me Nunik. I'm working in a research center for public health intervention under the Ministry of Health, Republic of Indonesia. I would like to share a little bit of a story that actually comes from finding from a research project that was supported by IDRC. The story is about a young mother, aged 90 years old, that was who experienced infant death at birth during her pregnancy last year on 2014. She was telling me that she was having a problem during the last semester of her pregnancy and severe stomach pains. Following her parents' suggestion, she went to the traditional healer and was told that she had abnormal fetus position. On the day during her delivery, she was in so much pain. And after this discussion with the husband and the father of the pregnant woman, and her mother also called the traditional birth attendant right away instead of calling the village midwife to help her daughter deliver the baby. The traditional birth attendant told them that the baby was in abnormal position, but because of the pregnancy age was already at 9 months and she could not fix the baby position. But usually for pregnancy age before 8 months, the traditional healer could fix the baby position by massage, a special massage, and symbolically using a plate, knife, and rice to rotate the position of the fetus. But unfortunately, in the end, the traditional healer decided that she cannot help to deliver the baby and asked the mother to call the village midwife instead. By the time the village midwife finally came to help her, it was already too late, and the baby had already died. The village midwife brought the mother to the nearest hospital right away, but it took about 45 minutes using a small wooden boat. This young mother and her family actually were living in a small village in a district of Murung Raya, which is about 10 hours driving to the capital city of Central Kalimantan. This story inspired me to seek different approaches to prevent the infant mortality in specific population at the village level, specifically the need to focus on building better connections between health workers and the community, including mothers and family as well as the traditional healers. Throughout my journey as a researcher, since 1996, I have learned a lot about the need for breakthrough approaches to improve the health of the most disadvantaged population in Indonesia. My interest in public health research was initiated from many questions that came out after learning from the grassroots or from the community. Although the Ministry of Health already has a national program on partnership between traditional healers and a village midwife from decades ago, there are still some mothers that put more trust on traditional birth attendants for maternal and infant health. Using a specific approach such as collaboration and good communication between local potential influencers like religious and ethnic leaders will build trust toward health workers for maternal and child health, and will allow family leaders like parents and parents-in-law to have more understanding about the importance of participating in antenatal care and using the health facilities and manpower during the birth delivery process. This is important because decision for maternal and child health care is not only made by the mother herself, but also made by the extended family, such as husband, parents, parents-in-law, and also grandparents. It is important to point out that we also need to improve access to high-quality health services that are equal for every mother and child, regardless of different ethnic, social, economic, and geographical aspects. This means that health providers also need to improve their resources in both infrastructures and skills and more comprehensive ways. The technical health skills, especially among a village midwife, is somewhat limited, especially in fresh graduate village midwife who will definitely need mentoring from senior midwives. to help with the delivery in the village health facility. Also, in most districts in Indonesia, the availability of valid and accurate data is a huge issue, and it requires more investment to improve skills and in data management and data utilization, because without having a good data, it will be hard to set a good program and priorities. Having a good communication and sensitivity to local cultural are crucial points if we are working within the village community in order to effectively convey the health message and behavior change. Another key point is that maternal and child health, as well as health in general, will need a real, active, and sustainable contribution from the non-health sectors, such as the local government, the education sector, home affairs, social welfare, transportation, agricultural, economic, and finance, and other related stakeholders that contribute indirectly to the population health. In other words, health in all policy is indeed crucial to improve health development in general and among those who need the most. I believe that once the local authority and leaders, as well as the community, make a breakthroughs or innovation that are generated by community needs and local potential resources to improve maternal and child health, it will eventually close the gap and prevent inequity as well as inequality in health development.